Hello there, I wanted to share with you about the vertebral arteries and atlas subluxation. Right here we have a set of arteries, and these three pictures are all similar. They're just showing different ways of looking at the two arteries that go through the top 6 bones in the neck and then back into the skull, and they form one artery that comes out and branches out and feeds the rest of the brain. If this is out of place, this top bone, it can kink these arteries that feed the head, and if it's twisted, it can kink them even more, depending on if you're malrotated, which is twisted, or if you're laterally subluxated, which is just going straight across, so the head kind of skips a beat this way. It'll kink the brainstem, or it'll kink the arteries, or both, or even block blood flow, cerebral spinal fluid flow, and all kinds of vital tissues from normal function. So your birthright is normal function, and oftentimes it's overlooked that this is an area that can kink that and distort it. That's our specialty, trying to help people get this, literally get your head on straight, because headaches, migraines, neck tension, and symptoms, some people don't even have any symptoms when this is out, and they can have problems elsewhere in the body. How does that work? Well, one of the mechanisms is the blood flow. If you don't have 100% blood flow to the back of your brain, which is 30% of the back of your brain is fed arterial flow from this set of arteries, then you're not going to get function to those nerves. And those nerves, which are the back part of the brain, most important part of the back part of the brain is the brainstem, which controls all vital function, including 12 or 13 cranial nerves, depending on who you're studying from. One of those nerves happens to be the vagus nerve, and that feeds the heart, the lungs, the pancreas, the adrenal gland, the large intestine, small intestine. There's so much going on that's vital to your life that's controlled by just that one nerve. And guess where it gets its oxygen? Right through these two arteries that feed the brainstem. This is something that everybody should be getting checked. We want to make sure that the atlas is centered. We don't want it out of place. If it's ever out of place, which is very common, it can distort not just the blood flow, it can also distort the brainstem. So get yourself checked, make sure that your loved ones are checked, and don't let people live subluxated, because it is one of the most common injuries that I've found that causes big issues in the back of the brain and even neurological problems, and it doesn't need to be there. It is correctable more often than not. So get yourself checked, do yourself a favor, don't learn years from now, I wish I would have known about this, which is a very common statement people say when they find about atlas subluxation. Look into it, come on in, get checked.